Center for Healing and Center for New Medicine here in Irvine, California. Welcome to another edition of our Monday afternoon, and for those of you on the East Coast, Monday evening health talks. So today I'm here to talk to you about an exciting new technology I brought to the clinic, and it's called Brain Gauge, and it's used to gauge your brain. It's used to determine what aspects of your brain are functioning properly and perhaps which aspects are not. Before I go to the next slide, I'd like to remind everybody that the information that I disseminate here today and for many of our lectures really is really good health advice and health information, and you're probably going to want to share it with your friends and family. Okay, so this Brain Gauge thing, how does it work? Well, as you can see in the slide, someone has their finger on what appears to be kind of like a mouse for a computer, and there's a stimulus that's applied mechanically, a little button, over actually two fingers. The index finger and the middle finger can be either on the right or left hand, depending on the handedness of the patient. And using the stimulus and doing different tests over the course of about 20-25 minutes, the machine can gauge based on how the patient responds, how fast they click back, or if they choose which of the buttons that vibrated more or less or that. The machine can actually gauge which parts of the brain are functioning properly and which are not. This technology has been researched for many years, I think over 50, the last 30 being at the University of North Carolina under Dr. Mark Tommerdahl. And it was originally, or one of the original intentions with it, was actually to see when football players, after a concussion, could return to the field. Because the biggest problem that they were having, and still continue to have if they don't use this brain gauge, is that the players are returning to the field too early, and if they get another concussion, it can cause major health problems both today and down the road. So I have a few slides for that later I can show you, but that's how this came to be. And they found out through the research this was so sensitive that it had many more applications beyond just concussions in football players. It can be for traumatic brain injury, and even in the realm of preventative medicine, and that someone notices they're having some mental decline, some cognitive decline, and they want to come in to see what they could possibly do. Then the first part of that is knowing which parts of the brain need to be worked on. So it helps with timing, connectivity, everything we see here on the right side of the screen. So the method that works, I'd like to say it's kind of like the eye chart that we've seen in a doctor's office or perhaps the DMV. And then it starts off very easy, where it's easy to see a letter, and then as you go down, it gets harder. So the Brain Gauge does the same thing with its series of tests over the 20 to 25 minutes. It starts off easy, and then it gets harder and harder, but if the patient doesn't get a certain number right, it'll actually become easier. So it's trying to zone in, and that's what actually makes it so accurate, is able to zone in right to the patient's level to see right where they start getting the puzzles wrong versus answering a number of them correctly. So it measures all of these on the left, everything from speed to time perception, plasticity, fatigue, focus, and the last one's called a cortical metric, and that is a composite score of everything above. Now, the test doesn't need to be set up to measure all 8 of the first listed there. You can measure certain individual ones, but here at Cancer Center for Healing and Center for New Medicine, we believe in doing everything. So we're going to measure everything and then give a final score at the end. And that's a linear gauge over there on the left. On the right, we see what's called a radar, where the same metrics are plotted out along this time a hexagram, because they're measuring 6 different items, and then it's mapped out. So their TOJ, their temporal judgment, is very good here, whereas their patient speed is quite poor. So knowing this information, tests and other warrant further diagnostic tests, such as an MRI or that, or if it's not so severe, different exercises and even games can be played to help the patient improve their mental ability and thus lessen cognitive decline. So the hypothesis of lateral inhibition, which is kind of the premise of how this works, go back to the 60s. And basically, as we see here on the left, there's an inhibition where there's nothing, and then there's an excitation which is put through. In fact, this is the device here. It's like a little mouse, and there's 2 buttons here. A stimulus is put through one or both of the buttons as an excitation and an inhibition. And it's our response to this that gauges how healthy our brain is. So what's been noticed through the research is that with one stimulus, the skin feels like a sign, like a wave over there, and then there's a perception in our brain that there was some motion. What was found is that when there's multiple stimulus, see there's multiple waves over there now, is that the perception actually gets harder, so that the patient perceives in their brain that the stimulus given had higher amplitude, it hit the skin more. So simultaneous versus sequential. So there's a number of tests that this runs, and we can see on the left-hand side of the screen, it's using 2 fingers. This happens to be the left hand, but if the patient is right-handed, it can be run on the right hand as well. And the stimulus is given at the same time. So you can see there's a higher stimulus given versus a lower stimulus. And the goal of this is for the patient to select which of the buttons stimulated or vibrated for a greater amplitude. So that's a correction. That's simultaneous. And then there's sequential, where one stimulus is given, and then there's about a half a second break. Another stimulus is given for a half a second, and then the patient has to choose. So using these over a series of tests can help piece together how this machine is able to determine which parts of the brain are healthy and which may be in decline. So I have this slide in here because what else has been noticed in the research is that lower levels of this GABA can cause these different symptoms, these different disease markers, which lead to lower scores on the brain gauge. So it's always good to correlate patient symptomology such that they do have a diagnosis of autism or epilepsy or head trauma or concussion or anything like that, that is taken into account, and then that with the results of this test used to determine a prognosis and a treatment plan. So it's been asked many times, well, as we get older, don't our brains slow down? Don't our brains, we go into cognitive decline definitively? The answer is kind of. It's not so simple. They did a study, and they found out that, and this is on the left-hand side, that as people age, their skin sensitivity, meaning actually where these little buttons are hitting on our fingers, on our index and middle finger, did the threshold to which what was needed, that's why it went up, meaning that it required more to actually feel something. So people were number, seniors sometimes don't have as good a blood circulation in their hands, have a bit of numbness. So that is understood. However, they studied the different age groups, which are mirrored over there, on the discrimination of actually amplitude, the actual pressing when this thing vibrates, and they found that it's similar from the 25-year-old age group to the 60-plus age group. So this works well for senior citizens as well, even if they have a little bit of numbness or such in their extremities. Oh, so this was talking the newest machine, the one which I purchased, is the Brain Gauge Pro. In the past, there's been problems with this latency error, and that's a huge word, but it basically means it's an error that's imposed in collecting the data by the machine. So the machine wasn't accurate enough to disseminate one test to another, which leads to a lot of problems. It gives, or can give, a false report to the patient initially, and also if the patient is coming in for initial visit and then going off to do some therapies or something to work towards a healthier brain, and then they come back for a follow-up session, it can give error there too, meaning showing the patient that maybe they're worse off than they are, or they're better off than they are. So in other words, those are acceptable. So anyway, they have this down to 0.3, whereas before with other test methods it was all the way up to 80. So what causes changes in reaction time, speed, accuracy? Well, we all know that traumatic brain injury, concussion, anything that's going to be damaged in the brain would be. And then, as was on the other slide, any of the ADHD, autism, any of those central nervous system disorders, also alcohol consumption, even insomnia. People that have poor sleep just have slower reaction time. They've proven that with car crashes. The factors that decrease the reaction time: fasting, having a good diet, obviously caffeine up to a point that doesn't make the patient too jittery. Tai Chi for relaxation. I like this one the best. Dark chocolate consumption, because it gives me a license to eat dark chocolate. And electroshock feedback, although we don't offer that here at the clinic. Okay, so going back to the research on this originally for using it as a gauge, brain gauge, to determine whether a football player post-concussion could go back to the field, they found out, again, this is just many more years of research, that the reaction time itself is different than the reaction time variability. So what really needs to be measured is the variability. That gives a much better stance as to whether the concussed person can go back to the back to the field, back to the healthy level here. So it was originally thought, just with reaction time, that it came a nice line, the orange line over here, the concussion came right back to healthy very nicely. We find out that actually after the 5th day after the concussion, the symptoms actually got a little bit worse, and then they got better. So it's a much more accurate way to judge it. One thing I really like about this machine is the report that it spits out. And you've seen these images in another slide, quite a bit larger, the radar that we were talking about before. But given an initial diagnostic, and then let's say a series of treatments or brain exercises, games, or whatever, patient can come back in and be rescanned, and then the results can be plotted on a chart. So they could come in maybe every other month, and we can see how the different parts of the brain are hopefully becoming healthier, or in the instance of trauma, traumatic brain injury or concussion, that the patient is healing. So I know this is small, but this is just showing 4 different patients over time, pre and post treatment, in those 8 different part areas which I was talking about, and also the main cortical metric. So it's showing it go, and I apologize for the little cursors going crazy, but it's showing befores and afters which would determine if the patient needs more therapy. It looks like all of these got better. Patient 3 didn't do much more for speed. So it shows where focus could be given for improvement. Okay, so now I'll take any questions, and feel free to type on the Facebook.
I have a question. So like the previous slides, it shows like the before and afters, like how many sessions, or I guess how many sessions does it take to like improve each of those categories or those skill sets, I guess? Like, I got an estimate time, I guess.
Okay, so the question was, how many treatments or sessions does it take to improve? And the answer is quite varied, because there's obviously different levels of cognitive decline brain, and there's different age groups. Younger patients tend to heal faster, and also degrees, if there is a trauma like a motor vehicle accident, concussion, or brain injury, different levels of that which affect different parts of the brain. But in general, we would, and what our plan here at Center for New Medicine is to, at most, administer this every month. So to do a diagnostic and then a series of treatments, and the treatment can be a brain biofeedback of that, say 10 sessions or something of that, and then reassess to see if we're getting any results. And also, we, of course, will take into account the symptomology of the patient. Usually patients know that they're better. If they are driving, they know that the reaction time driving is better.
And speaking about like treatments and stuff like that, so let's say my score is like low on speed and low on like TOJ or something like that. What type of therapies would help within or improve those types of skills? We're
currently implementing different therapies here at Center for New Medicine. Everybody's heard of Lumosity, and there's been some, which is an app that came out some years ago for improving brain health. I would like to see whether that, I personally experienced that, I would like to see whether that actually did help. But it would be those kind of brain exercises. They've even proven for anybody that doing crossword puzzles it would help. So these aren't major expensive therapies. Now in the case of a trauma, I would like to see before and after a series of hyperbaric oxygen treatments, because that's what's usually given for concussion and any other kind of trauma to the brain.
Who is the best candidate for the test?
Okay, so who's the best candidate for the test is the question, and the answer is anybody from a child to a senior citizen can be subjected to this test, because it's so easy. It's just one mouse-like thing with 2 buttons. It's not any kind of written or any kind of any complex testing as was done in the past. That even a child, I would say even at age 5, can probably start doing these tests. At least for when we first start implementing this here, I will be in the room with the patient to go through the different tests and what's going to come up in them. One of the touts for this particular device was that you could set a patient in a room alone and have them do it. And I even started to do it myself and thought, well, it's probably good just to have a practitioner in the room just to let the patient know what's going on so they don't get a false poor score.
And also, if someone is concerned they have dementia, would this be a test to take?
Absolutely, absolutely. What I see here in rolling this out at Center for New Medicine is a couple different kinds of patients. Those that are preventative. We have a number of patients that are preventive, perhaps somebody middle-aged saying, okay, I know that my brain is healthy now and I want to keep it healthy for another 40, 50 years. What can I do? And obviously we know diet and lifestyle and that are really high on that list. But also if someone suspects that they are starting to fall into dementia, they start just little things, start forgetting maybe where their car keys are or what exactly they did yesterday afternoon. This would be a really good test to see which parts of the brain aren't functioning as well and which are functioning. And then based on that, we can implement some kind of brain games, as I call them, like Lumosity or tests or something, even crosswords, like I said, some kind of a treatment plan the patient can be administered maybe for a month or two and then come back and be re-scanned by this to see if there's improvement.
Can it also detect like before cancer or anything, or is it just this list on?
Oh, it's a good question. So the question was, can it also detect cancer? No, however, if someone did have some cognitive decline all of a sudden, very sharply, without having a trauma like a motor vehicle accident or a concussion or something, then we would suspect something like that. And this wouldn't be obviously definitive. You'd want to do an MRI and some imaging, but this wouldn't be a bad test in 20 minutes to do to see if all of a sudden that one of these or more of these categories had suddenly decreased from what a normal score would be, which would lead to more diagnostic, but certainly be administered.
Is there like more tests besides the one on the list as well too, or is it just?
This pretty much sums up. Let me go back to the slide that had them all.
Okay.
So on the left-hand side, it's the first. There's 9 there. The first 8 are what it tests. TOJ, it's abbreviated because it's a temporal order judgment. So it's actually the judgment centers of our brain, which we use every second. We actually don't realize how many decisions and judgments we make in 10 seconds. I mean, it's where to put our foot, what not to do, how to talk to somebody, this and that. So that's what the TOJ is. And the other ones are listed there. And as I mentioned before, we don't have, you can just run 1 or 2 of these to check, but we're going to do a thorough evaluation, I think, is in order. We don't want to miss anything here. So.
What other, I remember you mentioned Luminosity as one of the recommended games to play, and as well as Sudoku and crossword puzzles to improve your memory. Is there any other app games you would recommend to improve all these skills and stuff?
Okay, so the question was, they remember that I mentioned Luminosity, and actually Sudoku is a good one to mention that, but the crossword puzzles. Is there any other, anything that exercises the brain? Think of the brain as, I don't have, I'll be broad on the answer with that because I don't have any other brand names, nor do I support that. However, anything that exercises the brain. My father is 77 years old, has the brain of a 45-year-old because he still is in his electronics lab every day. So anything that you feel, and I think what happens a lot of times with senior citizens is they are using their brain every day when they're in the working class, and then when they retire, they kind of stop doing that. They stop thinking, even reading. Reading is better than watching TV. So if you can integrate, and it can fiction that anything where you're consistently using the brain, and if your brain feels worked, you ever get the feeling like your brain's like getting warm, everybody's study for an exam at some point in their life, that's good. It just like the muscles of the gym getting worked, when they feel that they're worked, not steam coming out of your ears, but
yeah, like my grandma, she loves playing Tetris. Like every single day.
Oh, okay. So there's no Tetris. So some of the computer games are good. I know that I did a 1-year internship at a children's hospital, And for the children that were with the ADD and ADHD, that there was a biofeedback program. And this, I never got to watch it, but I've heard it was a big program that really helped them focus and get past some aspects of those diagnoses. Okay.
And Bill Sultan's, Dr. Bales is awesome.
Oh, thank you. Okay, well, good. Well, as I mentioned, this concludes another one of our Monday afternoon lectures here at Center for New Medicine. Hopefully everybody's having a good afternoon and a good evening. And please share this with your friends and family, because unfortunately, as we're noticing, as you mentioned, dementia and the broader list of Alzheimer's diseases are becoming an epidemic. 1 in 10 60-year-olds will develop Alzheimer's, and it goes up from there. So please share. Thank you.